Ms. Katz, I thank you for your kindness and for your generosity. And our philanthropy officer, Pilar Gose, mentioned to me that you're interested in understanding how you can facilitate the work that we're doing. And it reminded me of a very exciting period of my life when I observed an exceptional philanthropic opportunity take off. And it also brought to my mind a couple of opportunities that we have, and I'd like to discuss them with you if I may and share them with you. My hope is that you would want to open up a conversation about how we can approach this space, and I think it is a great opportunity for us to tap into your network and to hopefully see you as the patron saint of our department, so to speak. The Lucas family was a very wealthy family in the Bay Area when I was a trainee there. I was trained as an interventional diagnostic neuroradiologist at Stanford University. Gary Glazer was the chair. Gary Glazer connected with the Lucas family very effectively, and the Lucas family helped leverage their connections with their friends and acquaintances, and they built a small research building that became the nucleus for what is the most spectacular department in all of radiology right now. This is in 1991 when the Lucases were engaged. And what I saw at Stanford in short order was remarkable. I see a similar opportunity here. And the opportunity that I'm thinking about is providing our brilliant, exciting, and innovative faculty and research residents an opportunity to showcase what it is that they are discovering and working on. And I'll use some of my faculty. So Marin McDonald, as you know, is interested in imaging pain, not necessarily looking at whether or not a disc is pushing on a nerve, but whether that nerve is experiencing pain and explaining the pain that a patient is feeling. And so she has some proposals in that particular space. Rebecca Racco-Penner is one of my faculty who's a brilliant physician scientist, also is an MD PhD from Stanford, and she's interested in creating a women's imaging division that does women's imaging research so that we can screen for ovarian carcinoma before it's metastatic, and how we can look at pelvic floor imaging. As you may know, up to a third of women who've had children can have issues with continence at some point in their life. We haven't figured out how to diagnose it, and that diagnosis is essential to being able to address it. And Rebecca has some remarkable methods that she has developed that can help us look at the pelvic floor and pelvic floor dynamic motion and understand where correction needs to take place. I also have Div Bilar, who's a brilliant neuroscientist. And Div is able to look at how different parts of the brain receive their blood supply. What happens in patients who have stroke, how those patients recover after stroke, and hopefully what can be done to facilitate recovery. Albert Schau is one of my faculty who has figured out how to demonstrate the flow of blood three-dimensionally over time, which we call four-dimensionally, through large vessels and small vessels through the heart and through the brain. Again, being able to quantify the amount of flow. So when you're effecting a therapy, you can see if it's actually beneficial or not in that specific instance. I can only imagine if we were able to set these faculty through even a virtual forum in front of individuals who have been fortunate and want to give back to society. What a powerful set of sponsors they would be able to find. And the sky is the limit in terms of what we could accomplish as a department and as a university, tapping into the generosity of individuals in the community and the brilliance of our faculty, who are really, really remarkable. I would love to have a conversation, to have a chance to sit down with you and talk through how we could facilitate this work, or even putting together micro grants where we would offer faculty $5,000 to $10,000 a piece, maybe give out 3 or 4 microgrants a year, make it a competitive opportunity for them to put in proposals, and to have you participate in looking at the proposals and being a member of such a committee, determining where those microgrants are allocated and how they're utilized. I'm very interested in creating a sustained relationship with philanthropists in the community so they can realize their contributions and the effect that it has on not just the university community, but globally, because the reach could be spectacular. I very much hope that this stimulates you, Ms. Katz, to have that conversation, and I'm at your service. I would consider it the greatest privilege to have that opportunity to share my optimism about what we can be with you. Again, thank you very, very much for giving me this opportunity to share those perspectives with you.